Well, hello, this is Dr. Stephen P. Thane. I am a doctor of chiropractic, and today I'm going to be covering chiropractic, your brain, and you over the next 30 minutes. I'm going to go over an incredible study that was done in Denmark, revealing how chiropractic spinal adjustment affects the human brain and how this can impact you in regards to your back or neck problems, and even more importantly, your overall health. So with that stated, let's go ahead and jump right in. The first thing I want to discuss are what I call the two truths in regards to health. And the first truth or premise is that the body is self-healing and self-regulating. You know, if you've ever had a cut on your finger, a paper cut, you know, and it bleeds, you put it under the water, you wash it a little bit, you put a Band-Aid on it, it heals up. But here's what's amazing about that process of that simple paper cut. You know, when your blood vessel is broken, inactive clotting factors become activated. Platelets, along with red blood cells, form a clot. Fibrin strands form, and that thrombin converts into what's called fibrinogen, and it turns into fibrin. These fibrin strands provide a mesh for more blood cells to adhere to, which plugs the break. If you didn't have all those things happening, if that inactivated clotting factor didn't become activated, you literally would bleed to death from a simple paper cut. But you don't even think about any of it. It just all happens. You know, by the way, in addition to that, white blood cells are recruited to the area to strengthen the immune defenses. A scab is formed. It stays in place until the skin underneath completely heals and new skin is formed. Another example of the self-healing process of the human body. A broken bone. Now, I show this picture here that you see of the legs because I actually had this kind of fracture, a tibia-fibula fracture. And without any help from the doctors or from the cast that's put on the leg, the hematoma forms, a fibrocartilaginous callus forms, it turns into a bony callus, and the bone literally remodels. All of this happens. You know, when I had my leg broken, they put a cast on it. You know, the cast didn't cause my bones to heal. The doctor, who did a very nice job of setting the bones, he didn't cause my leg to heal. The leg, the bones, the body healed themselves. And that's what I want you to understand. Premise one, the body is self-healing. It's self-regulating. Now, premise two, truth two, is this fact. Physiologically, the brain and nerve system is the master controller. It controls, it regulates, it activates, it monitors, it stimulates every action of every function of every cell, of every tissue, of every organ, and every system in the body. This is physiologically how the body is formed. Now, from these two truths, from these two premises, we can derive a third truth. It's what we call a syllogism. A conclusion is derived from two premises or truths. And the syllogism about the human body is this. Any interference in the master controller of the body will reduce the ability of the body to heal and regulate. So with that, I'd like to take this conversation to a little different direction. I'm going to show you here a picture of a food processor. And you're probably thinking, what the heck? A food processor? Really? Why? Well, my colleague, Dr. Jubis, he tells me that he can make some amazing rum cocktails called the daiquiri. It's the granddaddy of rum cocktails. And he says with his food processor at home, he can make the most amazing rum cocktails. Well, that's incredible. Food processor can do that. But you know what? His wife, he tells me, can do all sorts of other amazing things. She can slice, she can dice, she can make soups and sauces, hummus, pesto, grate cheese, make dough, grind meat, shred veggies, chop nuts, and make no-churn ice cream. And I give you this analogy because this is a lot like chiropractic. Because in chiropractic, you can utilize chiropractic for back pain, and it's really good for that, like making good daiquiris. But that's not really the juice and the power of what chiropractic can do for you. So let's go into the study. I'll explain a little bit more of what amazing things chiropractic can do for you, just like the food processor. So this study was actually a study that was done in Denmark, and it was done at the University Hospital in Denmark. And what they did is they performed a study where they actually put electrodes on people's brains and they adjusted them. Now I'm going to go through the study real quickly with you. I'll explain some things to you, and then we will talk about what all of this means. Now, when we talk about articles like this kind of research. It's really hard to read things like this. So let me first share that I will try and go through and explain the words as best as I can. So first of all, the title: Manipulation of Dysfunctional Spinal Joints Affects Sensory Motor Integration in the Prefrontal Cortex. Wow, what a bunch of words. So let me break that down. First, manipulation. That simply means adjusting. Dysfunctional spinal joints means areas of the spine that aren't moving well. This affects sensory motor integration. What that is information coming into your brain, and the prefrontal cortex is a portion in an area of the brain. So this is basically saying we're adjusting areas of spine that aren't moving well, and we're looking at how that affects the information going into the prefrontal area of your brain. Now, the first area highlighted down there under introduction says, over the past decade, there's been a growing body of evidence to suggest that neuroplastic changes occurs following spinal chiropractic manipulation. What that means is neuroplastic simply means nerve function changes. So wow, research is showing that the nerve function of the body changes when you see a chiropractor. With this study, I'm going to go to the next page here. The next highlighted section says, with this study, we set out to utilize brain electrical source analysis to explore which brain sources are responsible for changes in N30 amplitude following a single session of spinal manipulation. So basically they're saying they were setting out to see what happens to the brain functioning when there's been an adjustment. The next highlighted area says 19 subclinical volunteers. So what they had is they had 19 people. They had a history of recurrent spinal ache and pain and stiffness, which they had not sought treatment. So they got a specific group of people who had pain, but had never been under care for that pain. By the way, the study was done at the University Hospital in Aalborg, Denmark. Now, they took a 62 scalp electrode device and they put it on their heads. And then what they did is they had them attend 3 sessions. The subjects were attend 3 sessions, a screening session for inclusion or exclusion, followed by 2 experimental sessions, one a control and one a chiropractic session, and those were in random order. Now, subjects that were excluded from the study were anybody who had no evidence of spinal dysfunction. So if their spine was working fine, they weren't included. If they had any current pain, they were not included. If they had sought previous treatment for these spinal issues, they were not included. Or lastly, if they had any contraindications to adjusting. By the way, they were treated by a chiropractor who had been registered for as a chiropractor and had 15 years of clinical experience. On the last highlighted section on this page, it says, as the subjects in this study were naive to chiropractic care, we provided a sham treatment session. So they actually did a fake adjustment. One of the investigators, who was not a chiropractor, actually provided this simulated chiropractic treatment session. So they did a real session, they did a fake one. So understand, they had 3 sessions. First one, they determined if they were included or excluded. They had to meet all that criteria. Then they had a real chiropractic adjustment and a sham adjustment, and those were in random order for the subjects. On the next page, under results, it says, upon questioning after both sessions were conducted, and despite the subjects being totally naive to chiropractic care, the majority of the subjects guessed correctly in which session they received the actual spinal manipulation and which was the sham. When asked why they were sure which session was real, the majority know they could feel that the chiropractic session actually changed the way their body felt and functioned. Wow, so they actually noticed the difference. Now, if you've been under chiropractic care, you know exactly what that means. I mean, when you get up from being adjusted, you feel kind of light and floaty. You have this change, this like warm sensation, a tingling feeling, kind of a rush, a relaxed feeling. Sometimes people are more energetic, but you definitely feel different, and these people notice that. Here it says there was a significant post-intervention difference between the 2 groups. So they saw a big difference in change of the conductivity to the brain between the 2 groups of the sham adjustment and the real adjustment. And let me share this with you. In the study with the sham adjustment, they saw no changes in all the people. But in the chiropractic group, they saw change in brain activity in every single one of them. The next page, it says discussion. This study resulted in 2 major findings. Firstly, this study reproduced previous findings of SEP studies that have shown that adjusting dysfunctional spinal segments alters early sensory motor integration. So what they're basically saying is, first of all, this study's been done several times now. It's been repeated, and every time it's the same results. And what they saw is that there was a definite change of the sensory motor input. The area of the brain, the prefrontal cortex, was altered in its function. Matter of fact, they saw an increase of 20% activity in that area after the dysfunctional areas of the spine were adjusted. The second major finding of the study, they were able to show using dipole source localization that this change in the sensory motor integration that occurred after adjusting the spine predominantly happens in the prefrontal cortex. Now, by the way, that's known as the executive function of the brain, and I will explain what that means in a little bit further. So let's go to the last page on the conclusions here. So this first paragraph on the bottom left says, the change in prefrontal cortex as seen in this study therefore suggests that the altered input from dysfunctional joints that leads to altered processing of somatosensory inputs can influence processing of somatosensory information by the prefrontal cortex. Wow, that's a big pile of words. What does it mean? It's saying in the prefrontal area of the brain, when you have dysfunctional joints in the spine, it literally alters the processing of information coming in from the body into the prefrontal cortex. And when you get adjusted, it shows that it changes that integration process that's happening in the brain. So, continuing on this sentence, chiropractic care by treating the joint dysfunction appears to change processing by the prefrontal cortex. This suggests that chiropractic care may as well have benefits that exceed simply reducing pain or improving muscle function, and may explain some claims regarding this made by chiropractors. Wow. So let me kind of break that down. So what they're saying is when we adjust the spine, we're influencing the prefrontal cortex of your brain. This alters the way your brain interprets information. Now, from a standpoint of helping with back and neck pain, when that happens, that's where the processing of the integration of muscle control occurs in the body. And this alters the balance between the involuntary muscles surrounding the spine and the voluntary muscles surrounding the spine. And what happens is it's kind of like resetting your computer. We reset the neuromuscular reflexes, which allows better integration of the voluntary and involuntary muscles around the spine, which allows synchronicity, smooth function, and therefore relieves back and neck pain. That is how a chiropractor affects your back and neck pain, is through altering the brain synapses process of the somatosensory input. That's what's happening when you get adjusted. Now, there are other things that happen from that, though, and I'm going to go into that discussion in just a moment. So lastly, the final conclusion on the right side. This study has reproduced findings of previous SEP studies that have shown that adjusting dysfunctional spinal segments alters the early sensory somatomotor input from the upper limb. It also expands on the findings by using dipole source localization to show that this change in somatosensory input that occurs after spinal manipulation predominantly happens in the prefrontal cortex. Hence, the mechanism behind pain relief following spinal manipulation in low-level pain patients are likely due to improved somatosensory input and appropriate motor control, as this is the key function of the prefrontal cortex. Wow. So this study's been done numerous times before. The results are always the same. People benefit significantly from the adjustments in their pain. It's because we are literally altering the brain and its function and the integration process. So with that said, let's go back to our understanding here again. Remember, the brain is the master nerve system, the master controller. The brain and nerve system controls everything. It activates, monitors, correlates, stimulates everything. So when we're altering the prefrontal cortex and that somatosensory information, we're literally impacting the way the body functions. So let's take a look at the prefrontal cortex. There's three major regions: the dorsolateral, or the prefrontal cortex, the anterocingulate, and the orbital medial. And these have different functioning facts, but this is called the executive function of the human brain. Now, the prefrontal cortex, we're looking at affecting emotional responses, attention, behavior, but there's so much more. It's involved in decision-making, memory and attentiveness, spatial awareness, eye movement, emotional responses, goal-directed tasks, increased sensory motor function, better joint position sense, increase muscle function and strength. And here's a key one, autonomic function. Now, autonomic relates to the control of the respiratory, digestive, endocrine, immune system. Wow. Are you telling me that when we affect the prefrontal cortex, we're influencing the autonomic function of the human body? Yes, I am telling you that. And this is why people feel better. This is why they focus better. This is why their balance is improved. This is why their athletic performance is improved. This is why their memory improves. This is why their behavior improves when they're getting adjusted. Because when a chiropractor makes that chiropractic adjustment, he is literally influencing the executive area of the human brain, the prefrontal cortex, and all of these things are dramatically enhanced. Now, another interesting thing about the prefrontal cortex, it is particularly rich in something called dopaminergic neurons. Now, the dopaminergic neurons are very influential in the production of something called dopamine. Now, the loss of dopamine is one of the most prominent neurologic disorders known as Parkinson's disease. Now, dopaminergic neurons play an important role in the control of multiple brain functions, including your voluntary movement and also behavioral processes such as mood, reward, addiction, and stress. Selective degeneration of these dopaminergic neurons does lead to Parkinson's disease. Now, I am not sitting here telling you that a chiropractic adjustment is going to cure Parkinson's. It's not. But what I am telling you, in the human brain, if you don't use it, you lose it. A chiropractic adjustment has been shown to alter the prefrontal cortex functioning by as much as 20%. If we can continue to enhance the human body's ability to articulate and fire those neurons, we're going to help your body to function more effectively. And I always like to share this story. I had a woman who was going through this class with me, and she raised her hand and she said, I'm 65 years old. I have no evidence of Parkinson's, but my mom, my aunt, my grandmother, every female in my family suffers from Parkinson's. She said, I've been getting adjusted for over 25 years. I wonder if that's had an impact. Now, again, I can't tell you the chiropractic is going to prevent or cure Parkinson's. But what I can tell you is that the prefrontal cortex is the most richly innervation of dopaminergic neurons. And if we continue to influence the brain and activate that area, we know that the brain functions more effectively when it's being activated and initiated. And what chiropractic adjustments do is massively influence the somatosensory input into that critical area of the brain. So take that for what it's worth, but that is an amazing discovery in understanding chiropractic. Now, we do talk about losing your normal cervical curve. You're supposed to have a normal forward curve. As an infant, you lift your head and your neck. You form a curve in your neck. When you lose that curve, we do know that reduces blood flow to the brain. If we reduce blood flow to the brain, we reduce activity and functioning and capability of the brain. I share this because when we increase the curve, it actually has been shown to actually increase blood flow to the brain. There was a study done on a device called a Denerol, which we commonly recommend to patients in my office. The Denerol, if used properly, has been shown to actually enhance and restore curve. You can see the picture on the left, kind of a straightened curve, and here we have a restoring of the curve. That was done by utilizing a Denerol. And if you increase the blood flow to your brain, or if you use the Denerol, you can increase the blood flow to your brain. So curve and posture is critical and important. So the big question, who do you know that can benefit from increased blood flow to the brain with 20% improved function of the prefrontal cortex? Well, that would be everyone. Who do you know that could benefit from autonomic function improvement? That would be everyone. My youngest patient was 40 minutes old. My oldest patient is 95. So if you're somewhere between 40 minutes and 95 years old, I can help you. Chiropractic can help you. If we improve the function of the spinal system, we enhance the somatosensory input to the prefrontal cortex, and that literally is going to influence the entire function of the human body. Thomas Edison once said, the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, diet, and the cause and prevention of disease. I think he was a man way ahead of his time. When you take a look at the human frame, the mainstay of the human frame is the spinal column. Housed inside that spinal column is the spinal cord. The cord attaches to the base of the brain through the brainstem. The brain communicates down through the cord, out through the nerves, to all the structures, organs, and systems in the body. Thomas Edison was dead on. As a chiropractor, we focus on carrying the human frame, taking care of the main core, the spine. We talk about diet. I'll tell you the cause and prevention of disease. There's three things that tear this human body down. Mental stresses, chemical stresses, things that we eat and are exposed to, and physical stresses. And in regards to physical stresses, the most critical physical stress in the human body is when there is stress and dysfunction to the spine, which is exactly what this Denmark study looked at. What happens to spinal dysfunction and how does it influence us? It affects our brain and how our brain processes and creates health, life, and vitality in the human body. Thomas Edison was right on. So I'd like to share a story with you, a story about a boy and his dad. Now the child, by the age of the father, by the age of 13, had a dozen rounds of antibiotics, over-the-counter medications commonly throughout each year, colds and flus 3 to 4 times a year, had the flu every single year, allergy shots bi-weekly, monthly, and missed a lot of school due to illness every single year. Now the son, on contrast, by the age of 18, had never had an antibiotic, other than literally only 2 tablets of Tylenol, never had any medications, no over-the-counter other medications, and no allergy shots. And no prescription medications at all. And you got to ask your question, how could there be such a huge difference between these two? Well, how does genetics play into this role? And what could make such a huge difference? Well, what I can share with you in this story is that the father had no chiropractic care in his childhood. The child had chiropractic care in the first hour of life and throughout his entire 18 years. And I know this story quite well because it's a story of my son and myself. That's the difference between his life and mine. He was adjusted since day one. And look at the difference. Huge. It's not all about genetics. There's more to it than that. And I will share with you, my story is like so many other colleagues' stories. There's children of the exact same way. Chiropractic has a huge influence. And this study from Denmark shows it, demonstrates it, and proves it. You improve the functioning of the integration of the prefrontal cortex, the executive function area of the brain, a part of the brain that literally influences every other area of the human brain, is the prefrontal cortex, and you will improve your health, life, and vitality. So, to bring things to a close here, I'd like to share this with you. When we look at the top 10 human values, and of course, everybody could have a different gradient of where they put these things, but I think that the first one and second one are pretty much inarguable. The top human value really is health and energy, because if you don't have your health and energy, nothing else really matters, at least not while you're on this earth. Whether you love to go out and hike with your significant other, spend time with your children, if you're a grandparent and you spend time with your grandchildren, if you're in your golden years and doing the things that you love to do, number one, you have to have your health and energy, or you can't be there for your significant other. You can't be there for support for your spouse or your children. You can't enjoy life with your grandchildren. You're definitely not going to enjoy your golden years. I know love is at the root of all things, but if you don't have your health and energy, you can't love to your greatest potential and ability. We take a look at health and energy as a value. I will tell you, in my over 3 decades in practice, I have learned that there are 2 elements that tip the scale. 2 things, and when it comes to the price to pay for health and energy, that will outweigh and push it out of balance. And I'll tell you, when the scale tips, you lose the number one most important human value, and that is your health and your energy. And these are the 2. They are time and money. And I'll tell you, when time and money becomes more important than your health and energy, the scale tips in the other direction. And that is not a good place to be. There's 2 people I always comment about, Steve Jobs and Paul Allen, 2 very famous people. Steve Jobs is the, Apple founder, and Paul Allen, one of the co-founders of Microsoft. They had more money than they knew what to do with, but they could not buy back their health. They could not buy more time. Time is invaluable. And I'll share with you that one of my mentors once told me, he said, those that don't make time and invest money in their health now will be robbed of time and be forced to spend money on illness and disease later. And that's so, so true. So I'd like to share this opportunity with you. If you can think of someone you care about, and if you feel that they could benefit from what you've learned in this session and watching this, I'd like you to email me personally and just in the subject, just put brain workshop and just send me a little email. Say, Dr. Thane, here's somebody I'd like you to take a look at. We'll offer to do an initial exam at only $29. Now, this is paying for a consultation with me. Including that consultation, I'll do an exam at no charge. I'll take any necessary x-rays at no charge. And that is my gift to you. If you have a spouse or brother or sister or child you want me to check, we'll see if we can help them. We'll see if chiropractic can turn on the life and vitality and energy in them. And it'll only be $29 to find that out. Now, if you are a Medicare patient, unfortunately, this does void you from the initial examination process. Unfortunately, Medicare does not allow me to do that. But if you're a non-Medicare patient, we will do this just for $29. If you are a Medicare patient, the initial exam will be just $45 for a brief exam. So with that said, don't hesitate. Send me an email, drthane@bellevuediscenter.com. Give me their name, give me their email, and I will put them on a list, and we'll reach out to them and get them scheduled for that initial examination. That's my gift to you for coming tonight or listening to this session. I started off my discussion today showing you two truths. The first one being that the body is self-healing, it is self-regulating. And the second truth is that the brain and nerve system are the master controller. It does control and coordinate all cells, all tissues, all actions, all functions in the human body. And we do know that if we interfere in that master controller, we will reduce the ability of the body to heal and regulate. And in Denmark, in that study done by Dr. Havik and several other colleagues, they proved this to be true, that the human body is absolutely impacted by the power of a chiropractic adjustment. If you are under care, congratulations. You've made a great decision to propelling yourself to a much more vibrant, healthy, and fantastic future with regards to your health. If you're not a patient and you're listening to this, give us a call. Send me an email. Let's get you in and get you checked and see what we can do to turn on the power and help you to be the healthiest you that you can be. Thank you very much for coming. I appreciate the opportunity to share this message, and I wish you a great rest of your day or night, whatever time you're watching this.